day, fellow South Africans and citizens of the world. And I challenged Philippe yesterday to respond to a video that I put up, and I'll put a link to it right below this video so you can go and have a look at it. And it involves the health minister, and that's an area that Philippe knows a lot about, seeing that he's a top doctor in the United Kingdom. And he's responded. And I'm going to read to you what Philippe said in response. He said, "Hi Scott, I wish that the comment would be quick and short. It isn't. Public health is one of the many reflections of the state of a nation. Its failure to deliver quality and quantum should be read with other main generally applied indicators, such as financial, industrial, safety and security, education, government debt, employment, corruption, and crime indicators, longevity, expectations, child mortality rates, and main infrastructure aspects of a country. They are intrinsically interwoven. In short, when a government bureaucrats care more or only about filling their own pockets unlawfully, the whole of the aforementioned and much more takes a bath. In South Africa's case, the ANC inherited a going concern in healthcare and much more, meeting or exceeding many first world standards. That is reflected in the international acceptance of degrees and credentials and the high pass rate, where admission registration examinations were required by law. All the ANC had to do was to maintain, improve, enhance, and develop what it inherited. The list is above, and then of course much more. From the starting blocks, they did the opposite. Virtually all standards required to run a country successfully and beneficially took a bath, and all but disappeared. As an illustrator, Singapore and its awe-inspiring success comes to mind. They also had a history of religious and racial intolerance, often violent, but the Singaporeans had a different level of intellect, ambition, mindset, and purpose. They drew a line under their differences and history and started afresh, but they did it in good faith. The ANC had its chance with the Truth and Reconciliation Commission. The history since then and the present have shown clearly bad faith. The Singaporeans had a real fresh start. The ANC wrecked their opportunity at one. And that is where the divergence began. Singapore, a steady climb. ANC, a race to the bottom. Health is an end result of many components mashing. It starts with a number of building blocks of good quality in place, many from the list I mentioned, and then some. Jobs, purpose, clean, comfortable and safe living conditions, and most of all, sound and plentiful nutrition are critical. Safe living conditions include access to consistently safe and good quality potable water, and consistently effective sewage systems, and hygiene and more hygiene, at work, at home and at schools. If this goes for a loop, the immune system weakens and is more open to failure. People get sick where they shouldn't not have. Imagine a classroom full of kids, a house full of people. One gets sick but no one else does. Or if some do, they recover quickly with minimal or no medical intervention. This is an indication of the majority having a strong immune system. Now the opposite. All are sick, save one or two. The sick ones need ongoing, perhaps chronic medication. Complications develop and may require advanced care, perhaps surgery, the result of a crap immune system. Humans are a bunch of systems, flying in close formation, put together by the lowest bidder. One system goes out of whack and the others will follow. Also known as PNEI structure, that makes us what we are, and that is a psychological, neurological, adrenal, immunological package deal. Thanks, Philippe. All these long words. When we are healthy, all this stuff works. When we get sick, all this stuff needs to be taken care of and repaired. Quick fixes are just that and generally don't hold for too long. Medical training is not a difficult one, but there is a lot to go through and filed away and understood and integrated with these 4 components. Learning to do that starts at home, then school. If parents are a mess, or the school or the teachers, there already are missed opportunities to give people the best start. Look at how Singapore runs things in this regard and the kids' performance. We get excuses, lies, nepotism, racism, incompetence, cronyism and corruption. The results in this country speak for themselves and will continue their race to the bottom. Singapore fielded a public statement by, I think, the president. He stated that absence of rule of law, cronyism, incompetence, racism, corruption are utterly outlawed in Singapore. All races are equal before the law and are expected to perform their contracted duties to the highest standards or take a hike. It is purely based on the principle of meritocracy. Best person for the job. Crime does time. The results speak for themselves. When Singapore pulled itself out of the dwang by its bootstraps, they did not have a shadow of the country that ANC inherited. Different mindset. Not only did the ANC not maintain the medical infrastructure it inherited, it deliberately wrecked what was there, year after year, including buildings, machinery and equipment, services and training, and performance standards of students and academics alike. There were no requirements or expectations to perform effectively, let alone any ambition to excellence. Compare Singapore. This went on across the board, from primary schools to medical facilities. Dumbed-down matrics cannot and should not go to medical school. They simply cannot hack it. Dumbed-down political appointees should not and must not teach them. Fruit from the poisonous tree, and the mess will get worse over time until the current standard is the norm. Work it out. Start with performance level 9 as an example. A 30% pass mark would be a 3. These are now the student, graduate and lecturer norms. Take a 30% pass mark or that and you're now at a 1. You end up with UCT students blaring out that science is un-African. I agree. This mindset leads to an ongoing determination and declining ability to apply the different diagnosis and the confidence to treat patients according to the PNEI principles go out the window. Result, no one really recovers and improves as they should. Then complications may present and things get really time-consuming and expensive. Still no takers. Now things get really out of hand and patients do not get discharged to make room for others. And because we are now at level 1 performance-wise, and not more than that is expected because there is no one left to teach it, or even know it in the first place, the whole system crashes, and that goes from the top down. Compare Singapore again. There are many first-class GPs and specialists in South Africa. How long they will stick around is anybody's guess. Should the ANC go ahead with their latest abortion, the National Health Insurance Scheme, a lot of these specialists are going on in years, and something drastic may need to happen to make them leave, like the National Health Insurance Scheme. If this is an indication of the drop in standards, check the insurance rates for obstetricians. Top drawer and highly experienced ones are quoted 1 million rand annual malpractice insurance premiums. Try find one now to deliver babies. They're paying for the incompetence. My clinics are ISO 9001-2015 rated for diagnostics, treatment, aesthetic medicine and pharmacology. They are also British standards and European norms rated for this lot. All we do is follow best practice and we pass our annual audits with flying colours. We have never had a clinic acquired infection. And further audit by insurance companies, we are rated as specialist service providers for a gaggle of them. Again, this background, we needed staff for our Harley Street London clinic. We make very good money there and are prepared to pay top dollar for the staff. We ended up with South African applicants. There are many black Saffers in London who are not keen to return to paradise. Many black doctors sitting admission exams in the UK don't make the grade and fail miserably. we decided to interview all applicants, irrespective of race and nationality. I would have my files for the day's work on my desk and share them with the black South African applicants for their comments. Without fail, all missed life-threatening conditions in 7 patients. They expected advanced laser training at our expense in the USA. They did not even have very basic training or know-how. One expected us to get her children into a good school of her choice, a house in the same neighborhood, a car and a job as practice manager for her black husband. All the above heavily subsidized by us, of course, and a salary, while she studied to get her UK registration. When we declined her application, we received a lawyer's letter of demand for compensation on the basis of racist selection procedures. We told him, in words of 1 syllable, where to get off, as she was not registered and had purported that she was, to get the interview. I lost track of her, but believed that she returned to South Africa. Quite frankly, her standards were dangerous and would have lost us a lot of accreditations. And the arrogance and demands, sadly she was not the only one of that caliber, but certainly the worst. Unless the Singapore model is followed, and there may be some time left to slow down the decay, health in South Africa is a basket case and irrecoverable. To get South Africa healthy, one should look well beyond the restrictive first aid healthcare model, get the standards up and recover the stolen loot, and employ competent, well-trained professionals. The overhaul in the bureaucracy in the schools and universities will be unimaginable. Add improvement to job access, nutrition, safety, and overall infrastructure. Investment and improved tax base to rebuild hospitals might just follow in time. But for this to happen, you need the Singapore model and a whole bunch of Singaporeans and a law-abiding, non-racist, honest meritocracy. To trade what they have for what South Africa has to offer, they would be nuts. It is a bit longer than I thought, but the opinion you asked for is a complex question. Hope it is of some interest and hope that it may be useful and make some sense. My very best wishes and kindest regards. Well, thanks, Philippe. That's great. It's always good to get an expert physician's position on what's going on in the health area in South Africa. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, stay safe. Bye for now.